in Africa and in Uganda in particular, we have had a long-term challenge of poverty, disease, and ignorance.
It's a big problem. That is a national issue. Whenever I tell people what I'm doing, they say, no, you are mad, you can't do this. I said, yes, you know, most of the things are done by mad people, so it's fine. KIHEFO started around the year 2000. By then, HIV/AIDS was out of control. First, I was working in a government hospital. The resources were not enough. At times, you see people die where you could help, but you can't help, and you have no power to say, let these resources be there. I felt I was not doing enough to help these people. So I started my own private clinic. Initially, this was not to start an organization. The initial focus was to help people.
I had my two brothers who were HIV positive. So they were so weak, we almost lost them around 2002. One who died last year, 2010. Another one who died 2009. I believe KIHEFO sustained them to live to that moment.
I've lived with HIV and AIDS for some time. It's about now 10 years. I first came as a patient. I couldn't even eat. I couldn't walk. But now you see, I'm okay.
My sister was able to accept that she's living with HIV and AIDS, and that living with HIV and AIDS is not a death sentence.
Because of the corruption that we have here, government hospitals at times they have no drugs. Patients opt coming to KIHEFO where they get the services. Some come from 20 miles away from the town.
When they have the disease, you must treat the disease. Then as you treat the disease, you know that this disease has a cause that is preventable. Disease, poverty, and ignorance are interlinked. And you cannot handle one without handling the other. So with the time, we had to refocus the way we work. We have to go back to the community. KIHEFO started with 3 people, but the number kept growing. 10 years later, we have a total cumulative number of about 6,000 people registered. I can say KIHEFO started as a clinic, but now it's a development organization.
The kind of patients that come to KIHEFO are those who are HIV positive. Others are those who have children that are malnourished.
We take out medication to people who can't afford to come to town. We have a program for malaria prevention. Then we are going into maternal health. Maternal mortality is very, very high still, and it needs to be addressed. KIHEFO has gone into one issue after another. Whatever issue comes out, we just take it up. As you're educating them, at the same time, you also empower them how they can generate income.
It's because they don't even have the capital, maybe to start up some businesses or to have some income generating activities that would help them to improve their livelihoods.
Most Ugandans are based on agriculture, and that's the best they can do since most of them are not educated. KIHEFO decided to go to the grassroots by providing agricultural inputs.
We have been in touch with her for the last 4 years. All her children died, and then she had 3 grandchildren. So we gave her 2 goats. We needed 2 goats to pay school fees for 1 year. Now they are 5. By the end of this year, they will be 7. If you empower a family, a household, they have their own income. They should be able to send children to school, buy medication, provide a balanced diet, and that empowerment will really give us fulfillment. We get satisfaction.
People really see KIHEFO as an organization that is growing and that is going to bring more services to them.
Traditionally, doctors just sit in their clinic and wait for people to come. But my dream for Uganda is for all doctors to reach out to the community. We are looking at this to be a model for Uganda, then eventually for sub-Saharan Africa.
It may be in the near future we'll get a generation free of HIV and AIDS. We don't know, but we hope so.
Now a Ugandan knows one day I can also have income to build my own house. I can have income to sustain my children. People are getting hope.
You feel happy, you know, when people appreciate, when people feel happy, you know, that's part of the excitement. And it's a motivation, you know, it motivates you to work more.
KIHEFO does not belong to one man. It belongs to the society, to the community. It is actually an organization of the many.
KIHEFO gives them a lot of hope, and they are putting all their future in KIHEFO.